Evaluation plan for a training program. Interview with a training evaluator. Group 5, Joe Martin, Sherry Parson, Jennifer Brown Edwards, Emily Tanner. Dr. Diane Chapman serves as the Director of the Office of Faculty Development, in addition to her role as a teaching professor in the Department of Educational Leadership, Policy and Human Development at the NC State University. According to her faculty profile, she has overseen the operations of NC State Office of Faculty Development since 2012. She is a recognized program evaluator and teaches courses in the areas of program evaluation and instructional design. Dr. Chapman managed the development and operation of the T&D online Masters of Ed and certificate programs at NC State University from 2002 through 2012. Prior to coming to NC State, Dr. Chapman served as a coordinator of online instruction at the UNC Chapel Hill School of Public Health and has over 20 years of HR and training experience in the private sector. She has received numerous awards for her work in the field of adult education. Dr. Chapman examines faculty development in higher education, program evaluation and workforce development, virtual human resource development, and instructional technology in teaching and learning. She holds a doctorate of education in adult and community college education, specialization in training and development from North Carolina State University. She has a master's of business and administration from Western Carolina University and a bachelor's of business and administration in advertising and marketing from Western Michigan University. Her areas of research include assessment and evaluation, community college, curriculum and instructional design, doctoral education, professional development, workforce development, and vocational education. Dr. Chapman shared her experiences in the field of evaluation in adult education in an interview conducted on July 15th via Zoom. A set of questions was prepared to learn more about her background in the field of evaluation, what trends she's experienced in her career, what models of evaluation she most frequently uses, and what challenges she has faced. Dr. Chapman explained that she began her career working in the private sector in business management, but has always been interested in evaluation to explore what works and what doesn't work in various types of human resource trainings. However, after 20 years in business administration, she decided to pursue her doctorate in education to become formally educated in the field of adult education. Since then, she has worked in the distance education, instructional design, and faculty development roles. She was a very valuable resource to interview for this project, and she was able to share a wide array of experiences and knowledge regarding the evaluation. Dr. Chapman stated that she uses a mix of evaluation models. Kirkpatrick model, New World. However, she does not focus on the area of reaction. She's more interested in how did the experience change individuals' work performance. Utilization-focused evaluation model, based on the principle that an evaluation should be judged according to how useful it is for the intended users. And the CIPP evaluation model, an evaluation model that requires the evaluation of context, input, process, and product in judging a program's value. Dr. Chapman stated that a major challenge for her recently has been COVID-19 and the impact on her ability to evaluate and trust the data. For example, the evaluation of a face-to-face course that has been quickly modified to be an online course. The evaluation results of an online course could be an anomaly and would not, i.e., typically be a weakness found if the course were in its normal classroom environment. Dr. Chapman stated that the most rewarding part of her job as an evaluator is helping people make programs better for their participants. She also stated that seeing a program flourish by utilizing her ideas and suggestions is also rewarding. Before concluding the interview, Dr. Chapman shared her advice for those new to or considering the field of evaluation. She encourages evaluators to gain the foundational skills to understand and analyze both qualitative and quantitative data. She suggests that new evaluators should rely on evaluation models as a guide to help them learn and remember the needs of learners, know how to follow the steps of implementation, and maintain the integrity of each step in the training and evaluation. Negative evaluation results. One last piece of advice Dr. Chapman shared during our interview was was that no one wants a negative evaluation. She stated that there's a lot of pressure on evaluators to give positive results, or at least to state things in a positive way, since those evaluation results could lead to the end of a funding for a program or loss of jobs. Despite these pressures, she notes that evaluators are hired to be critical and objective. She metaphorically asks, if we as evaluators are not being critical, are we really finding ways to help people improve their work performances? And are we adding value to their organization? Evaluators need to have the forethought to understand and know how they will navigate these challenges through frequent, clear discussion and communication of expectations at the beginning of a program, and by intentionally thinking about who will be reading reports and making decisions based on the feedback given in those evaluator reports. She recommends that explaining to stakeholders that the evaluator's role is to share facts about what is working and not working, not to speculate on whether to fund or defund a program or to deliberate on the personalities of people. Much thanks and appreciation to Dr. Chapman. Dr. Chapman's work and experience and academic background have allowed her to become an authority on the process of evaluation and a valuable resource to our presentation. We are grateful for the time and insights offered for this interview. Of the key takeaways from this interview, Dr. Chapman encourages the use of a varied set of evaluation models to allow for the appropriate evaluation to be conducted given a specific need or scenario. Do not initially overload yourself with too many models, as it is important to practice and familiarize yourself with them thoroughly. Evaluators can demonstrate their value by developing a working understanding of qualitative and quantitative analysis. And one of the most common pitfalls in evaluation is speculating on feedback rather than interpreting. An evaluator must stick to the facts, and the more skilled you can become in interpreting these facts, the better you will be at able to communicate the results. Dr. Chapman encourages trainers new to the field to embrace transparency, despite the common pressure that exists to produce results in a positive light. An evaluator must remember that their responsibility is to present the facts. Dr. Chapman makes mention in the interview of the importance of references that support your ability to analyze data. In addition to strong references, Google Certificates offers a data analytics certificate through Coursera. The course requires a monthly subscription to Coursera, which can be canceled at the conclusion of the class. The course is self-paced and does not require any prior experience in data analytics. Thank you for